Hi, my name is Annalisa Ferrotta, and I'm a fifth-year PhD candidate in pharmacology at Weill Cornell Graduate School of Medical Sciences, and I was awarded the Predoctoral Fellowship in Translational Medicine. My research path became more personal when I was in high school, and my aunt was diagnosed with cancer. And it unfortunately carried a very poor prognosis. However, she was enrolled in a clinical trial, which extended her life far beyond what doctors expected. And it was my first experience seeing how discoveries in the lab could translate into more meaningful time with our loved ones. So that truly inspired me to pursue research, ultimately studying cancer biology in college in my undergraduate research, and eventually my PhD in pharmacology, where I truly try to focus on translational medicine that can bring that real impact to patients and families. My research focuses on glioblastoma, which is the most common brain tumor in adults, which carries an extremely poor prognosis. Unfortunately, the standard of care has remained unchanged for nearly 20 years, and it does not provide much benefit to patients. So GBM tumors have been extensively characterized, and it's been shown that the PI3K pathway, which is a signaling pathway that promotes cell growth and proliferation, is overactive in nearly all of these tumors. And this initially created a lot of excitement because there were already PI3K inhibitors in development for other cancers, which ultimately led to their FDA approval for those cancers. And while preclinical studies looking at these inhibitors in GBM were extremely promising, every clinical trial so far has failed. So my research seeks to understand why. Why did these inhibitors that should have worked based on our knowledge of this cancer, why did they fail? Specifically, I am looking at different mechanisms that may drive resistance to PI3K inhibitors in GBM. The ultimate goal is to understand how we could overcome these resistance mechanisms and ultimately provide newer and effective therapeutic options for patients with GBM. Science can be so humbling. It is one of the most humbling experiences I've ever had in my life. So many experiments fail. Hypotheses often will not pan out. But there are incredible highs where you see years of effort come together and you begin to see the true impact that your work potentially can have. And it's chasing those moments when you're at the lowest of lows that keeps me going personally. And on a more personal note, I always think back to the joy that I felt when I was able to make memories with my aunt that I otherwise would not have had it not been for the clinical trial she was a part of. And knowing that my work can provide that same joy potentially for another person and their family is a constant, endless source of motivation for me to push through the difficult times that inevitably come with the pursuit of science. Looking ahead, I would like to lead my own lab investigating novel cancer therapeutics. Perhaps most importantly to my aspirations is I want to do this in a place with strong clinical ties, where I have the opportunity to collaborate with physicians who are seeing patients every single day and truly can speak to the patient experience and what is the state of the clinic at that time. I believe that it's essential to ensure that our research is really focused and relevant so that we are pursuing therapies that are ultimately translatable to patients and will truly make the difference in their care.